Doctors say it is preventable, yet so many women are still diagnosed each year. Let's talk about cervical cancer. The cervix is the lower part of the uterus that connects to the vagina. Cervical cancer is a cancer of the cells and tissues of the cervix. It all begins with human papillomavirus, which is sexually transmitted. This virus infects the cells of the cervix, causing them to become abnormal. These abnormal cells can eventually develop into precancerous cells, which can become a precancerous lesion, which if not detected or treated, can become cancer. So anyone with a cervix can get cervical cancer. But any woman who has been sexually active would be at increased risk of cervical cancer because of exposure to human papillomavirus. A common misconception is that only women who have had multiple sexual partners are at risk of getting cervical cancer, and this isn't true. You only need one partner or even limited amount of partners to be exposed to human papillomavirus. Another misconception is that if you feel fine, you don't need to worry about cervical cancer. Cervical cancer in its early stages often has no symptoms at all. Cervical cancer is one of the few preventable cancers. It's preventable because we have a vaccine against human papillomavirus which causes it, as well as there is a powerful screening tool called a pap smear. A pap smear can detect early abnormal cells as well as precancerous cells. That means you can actually prevent cervical cancer before it even forms. And so it's a preventable cancer. Cervical cancer in its early stages is often quite silent. However, if you do experience symptoms usually are abnormal vaginal discharges, abnormal bleeding, so you're having blood when it's not time for your period, or you may be having bleeding after sexual intercourse. Another common symptom is pelvic pain. Because it's a silent disease in its early stages, if you wait to observe symptoms, that often means advanced disease is present. Well, a new year is a new opportunity to be proactive about your health. And including cervical screening in your wellness plan for the year is an effective step in doing so. I think all women should be reaching out to their healthcare providers this year to get their regular health checkups, inclusive of their cervical screening.